40% of the global human population is at risk of acquiring a virus transmitted by the Aedes aegypti mosquito this year. 40% of the human population, it's a huge number. The viruses that are being transmitted by this mosquito go by different names. Dengue, Zika, chikungunya, yellow fever, all diseases that can have devastating consequences for people and communities that they infect. They can kill people to start with, the most obvious outcome, but they can also have more subtle outcomes that are similarly devastating. For example, the recent Zika outbreaks in South America saw the birth of babies terribly deformed by the presence of these viruses. Unfortunately, these babies being born into families and countries where there was really no social safety net to help them. We also see that generally these diseases put a large social and economic brake on communities and countries, preventing economic development from occurring. And finally, we see that when we have major outbreaks of these diseases, that they clog the health system. Hospitals get overrun with people seeking medical treatment. By solving this problem, we can make health systems much more resilient than they currently are in some of the poorest countries of the world. The easy solution, you would think, is just kill the mosquitoes. And while that approach has been tested and tried for many decades now, what we know is that it doesn't work. It's very hard in big urban tropical cities to kill all of the mosquitoes. They're living everywhere around us. We have a solution that's almost the opposite of trying to kill mosquitoes. We actually grow mosquitoes in the laboratory and release them into communities. But the mosquitoes we release are different to the ones that exist naturally. The mosquitoes we release contain a naturally occurring insect bacteria. It's called Wolbachia. We release mosquitoes that contain Wolbachia into the population where we're wanting to treat. And then that Wolbachia spreads itself into the mosquito population and maintains itself there. And what we find without having to kill the mosquitoes is that they become harmless to people. We don't see any disease being transmitted. We don't have to keep administering it year after year as you would with spraying an insecticide or vaccinating children. This is a solution that's applied once and then it creates ongoing protection against the transmission of these viruses. And the result of that is that in many built-up urban areas around the world, this solution is cost-saving for the countries and governments where it's been implemented. We know our solution works. Our challenge now is to really scale it up and get it to the people that need it throughout the world. $1 to $5 million can help us do that by expanding the approach we're taking in Brazil and Indonesia. We can go to new cities and to be able to make an even bigger and bolder impact with what we're doing to show neighbouring countries what can be done with this intervention. With donations up to $10 million, we're able to expand what we're doing into other countries. There are over 100 countries around the world where these diseases are creating havoc at the moment. And with the addition of this funding, we're able to then allow those countries to get access to this technology to help improve the health of their populations. As a scientist, I feel like we're at a very unusual point in time. We've been working on something here for many, many years, and we've gotten to a point where we now have something that could potentially have a huge impact globally. I'm hoping that people will be willing to work with us and come along on the journey that we believe is in front of us to get rid of these diseases once and for all.